తలనొప్పి, నరాల బలహీనత, మూర్ఛ వ్యాధి, పక్షవాతం, బ్రెయిన్ స్ట్రోక్, బ్రెయిన్ ట్యూమర్స్, మెడ, వెన్నెముక సమస్యలు, పక్షవాత సమస్యలకు పరిపూర్ణ వైద్యం. మన దేశంలో ఎక్కడా లేని ఆపరేషన్ థియేటర్, అమెరికాలో జరిగే వైద్యం ఇప్పుడు గుంటూరులో. చిన్న కోత ఆపరేషన్ల ద్వారా కేవలం 2 రోజుల్లోనే డిశ్చార్జ్. డాక్టర్ రావ్స్ న్యూరో హాస్పిటల్, గుంటూరు. సంప్రదించండి 9010056444, 9010057444.
Medical treatment of pituitary tumors. Medical therapy for pituitary tumors aims to reduce hormone overproduction and, ideally, shrink tumor size to alleviate symptoms. Here's information about medical treatment for prolactin-producing tumors, prolactinomas. A. Prolactin-producing tumor, prolactinoma. What are the benefits and limitations of medical treatment? In many cases, medical treatment can effectively normalize prolactin levels, alleviate symptoms, and reduce tumor size. However, effectiveness can vary between individuals. Limitations include the potential for side effects, variable responses, and the need for ongoing treatment. How do the medications work? Medications like cabergoline and bromocriptine belong to a class called dopamine agonists. They mimic the action of dopamine, a neurotransmitter that inhibits prolactin secretion. These medications reduce prolactin production and normalize levels by binding to dopamine receptors on tumor cells. Why don't these medications permanently reduce prolactin to normal levels? Tumor size, patient tolerance, and individual variations in drug sensitivity are just a few examples of the variables that can affect how well a medication works. Some tumors may be more resistant to treatment. Do these medications cure the tumor? Can I stop the medication later? While these medications can significantly shrink tumors and normalize hormone levels, they do not permanently cure the underlying condition. Tapering or stopping medication can be considered if prolactin levels remain stable and tumor size decreases, but this should be done under medical supervision. Is one medication more effective than another? Cabergoline is often preferred due to its higher potency and less frequent dosing than bromocriptine. However, the choice of drugs depends on individual factors and a doctor's recommendation. What if I wish to become pregnant? Both cabergoline and bromocriptine can be used during pregnancy under medical guidance. Cabergoline is generally preferred due to its safety profile. How many times a day are these medications taken? Bromocriptine is usually taken multiple times a day, while cabergoline is taken once or twice a week, making it more convenient for patients. Are there any potential risks to taking cabergoline or bromocriptine? Both medications can cause side effects such as nausea, dizziness, and headaches. Rarely, they may lead to more serious issues like low blood pressure and heart valve abnormalities. If my prolactin level returns to normal, will I be able to get pregnant? Normalized prolactin levels improve fertility. However, pregnancy should be discussed with a healthcare provider to ensure optimal management. I don't want to become pregnant now. Can I take a birth control pill? Birth control pills can be used alongside prolactinoma treatment. Will I have to take bromocriptine or cabergoline for the rest of my life? The duration of treatment varies. Growth hormone producing tumor, acromegaly. Why should I have treatment after I've had surgery to remove the tumor and I feel better? Some residual tumor tissue or hormone overproduction might remain even after successful surgery. Therapy helps ensure complete control of hormonal levels, prevents tumor regrowth, and reduces the risk of long-term complications. My tumor makes growth hormone. What is the IGF-1 test, and why is it important? Insulin-like growth factor 1, IGF-1, is a hormone that reflects the overall production of growth hormone, GH. Elevated IGF-1 levels indicate excessive GH secretion and ongoing disease activity, even if GH levels appear normal. Monitoring IGF-1 helps assess the effectiveness of treatment. What is the role of medical treatment for a growth hormone-producing tumor? Medical treatment is used to lower GH and IGF-1 levels, even if surgical removal of the tumor is not wholly successful. What medications are available for the treatment of acromegaly? Medications called somatostatin analogs, e.g., octreotide, lanreotide, are commonly used. They mimic somatostatin, a hormone that inhibits GH secretion. Dopamine agonists, e.g., cabergoline, can also be used. Pegvisomant, a GH receptor antagonist, directly blocks GH action and is another option. How effective are medications? Medications effectively control GH and IGF-1 levels in a significant percentage of patients. The response varies. Some patients achieve expected levels, while others experience substantial reductions in hormone levels. What are the side effects of these medications? Side effects can include gastrointestinal symptoms, nausea, diarrhea, injection site reactions for injectable forms, and, in rare cases, gallstones. Dopamine agonists can cause dizziness, nasal congestion, and digestive issues. Regular monitoring helps manage potential side effects. Can medical treatment be used instead of surgery for acromegaly? Surgery is often the primary treatment. When surgery is not practical, when there are still tumors after surgery, or when surgery does not entirely control the tumor, medical therapy is an option. Does medical treatment shrink the tumor? Some medications can lead to tumor shrinkage, but the primary goal is to control hormone levels and symptoms. Tumor shrinkage might take time and may not occur in all cases. 9. What is the cost of medical treatment? The cost of medical treatments varies depending on factors such as the specific medication, location, and insurance coverage. Medical treatment of pituitary tumors. ACTH-producing tumor, Cushing's disease. Are there any medical treatments for ACTH-producing tumors? Yes, medical treatments can be considered for Cushing's disease if surgery is not entirely successful or is not an option. Medications like ketoconazole, pasireotide, and cabergoline can lower cortisol levels and manage symptoms. What are the side effects of ketoconazole? Ketoconazole is an antifungal medication that can also suppress cortisol production. Side effects may include nausea, liver enzyme elevation, rash, and potential drug interactions due to its impact on liver enzymes. What are the side effects of mitotane, Lysodren? Mitotane treats Cushing's and can cause nausea, vomiting, diarrhea, rash, and neurological symptoms. Regular monitoring of adrenal function and other parameters is necessary due to its impact on the adrenal glands. I had pituitary surgery for Cushing's. Why do I have to take steroid, cortisol, replacement, hydrocortisone, Cortif, prednisone, or dexamethasone? Pituitary surgery can disrupt the balance of cortisol production. Sometimes, the pituitary's ability to signal the adrenal glands to produce cortisol might be compromised. As a result, patients may need cortisol replacement to prevent adrenal insufficiency. I have been cured of my Cushing's. Why don't I feel normal 6 months after my surgery? Even after successful surgery to remove an ACTH-producing tumor, it can take time for the body to recover from the effects of excess cortisol. Patients might experience fatigue, weight changes, mood swings, and other symptoms as their body adjusts to normal cortisol levels. Individual responses to medical treatments and recovery from Cushing's disease can vary. Patients must maintain open communication with their healthcare provider to manage symptoms, monitor progress, and adjust treatment plans.